Oh, it's just those days of the month. She is so irritating today. Why is she acting so funny? She must be PMSing. Don't disturb me. Just leave me alone. I don't want to do anything. I just feel like crying. Oof, I can't even sleep. Why can't people understand I am not overreacting?
So it's real. She's not faking it. Let's not judge her. It's not one of the tantrums. Just because few women do not get it, it doesn't mean it doesn't exist. Let's not just be sympathetic towards her, let's be empathetic towards her. So, hello everyone, this is Dr. Anjali Kumar, once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. So, today we will be talking about PMS, premenstrual syndrome. What is it? Is it real? Why does it happen? And what can we do to tackle it? So you must have heard people talking that she's PMSing. So what is a premenstrual syndrome? So premenstrual syndrome is basically a combination of emotional, mood, physical and even behavioral discomforts and symptoms which a woman experiences just before her periods. And they could be severe enough to affect her quality of life or maybe even her relationship with people around her. So statistically, it is said that almost 80% women have experienced some kind of premenstrual symptoms sometime in her lifetime. Out of these, about 50% women may just have mild symptoms. About 20 to 25% women may have slightly severe symptoms, while about 2 to 5% women may actually have very severe symptoms. This is known as premenstrual dysphoric disorder or PMDD. And these symptoms, they typically typically start in the second half of the cycle, typically about 5 to 7 days before the start of the periods. And surprisingly, these symptoms just vanish 5 to 7 days after her periods. So what are the symptoms of PMS? Now, they could be psychological and they could be physical. So the psychological or the mood symptoms could be there is anger, irritability without any reason, she's having stress, anxiety, feeling fearful all the time, restlessness, not able to sleep, depressive symptoms, crying spells, not able to concentrate, and these women actually at that point of time do not want to talk to people. So social withdrawal. While the physical symptoms could be fatigue, generalized body pains, joint pains, abdominal pains, cramps, swelling all over the body, feeling of bloated feeling all over the body, breast pain, headaches, and mind you, all these symptoms are real. So now let's understand what causes PMS. So PMS is supposed to happen because of some interaction between the female sex hormones, which is the estrogen and the progesterone, and the chemicals at the brain, which is the serotonin and the dopamine. These female sex hormones are also supposed to interfere at the level of kidney, leading to disturbances at the water and electrolyte mechanism of the body, leading to weight gain and bloating. Now, why some women get this, we really do not know. PMS is also linked with the history of depression, anxiety, people who have a history of some kind of emotional abuse, some kind of a domestic violence, or even the substance abuse. So how do we diagnose that it is PMS and nothing else? So it is typically based on this specific history that the symptoms appear just before the periods and they just vanish after the onset of the menstrual flow. So make sure that you always give a detailed history to your doctor make sure that you record your symptoms, journal them nicely. And as doctors, obviously, we also want to rule out that there is no other associated disease to cause these symptoms. So we also like to do a test for the thyroid, maybe a blood sugar, we get a complete blood count done and an ultrasound also. So what can be done to take care of PMS? Mild cases might just require simple dietary and lifestyle changes. In case somebody is having severe symptoms, you might need to talk to the doctor and take some medications. In case somebody is suffering from PMDD, which is premenstrual dysphoric disorder, you actually might need medications and even some psychiatric intervention. So let's talk about what can you do to take care of the lifestyle changes. So number one is diet. As I always say, the diet has to be simple, healthy, homemade diet with a healthy mix of cereals, grains, pulses, fruits, vegetables. Obviously, stay away from caffeine, alcohol, smoking. Stay away from vegetable oils, vegetable refined oils. Instead, include healthy fats in diet like coconut oil, homemade butter, desi ghee. Coconut oil actually is a surprising remedy for the PMS. So you could be having a lot of supplements also which could help you in PMS. So folic acid supplementation, vitamin B6 supplementation helps. Taking vitamin D every day, 400 IU every day is very, very important for PMS. Calcium supplementations. You could also include natural sources of calcium in your diet, which is low-fat dairy, sesame seeds, almonds, leafy green vegetables. I hope you all have heard about how magnesium helps in PMS. So in fact, most of my patients with PMS, I always prescribe them to take 1 or 2 bananas every day in the premenstrual period. Bananas are actually very, very rich in magnesium, and magnesium is something which reduces bloating, uterine cramps, body pains, joint pains. So make sure that you take bananas, avocados, dark chocolates. I know we all love it. Grains, pulses, tofu. So basically, healthy diet. Next is good exercise. So exercise, when you do a good exercise, it releases serotonin. Now, serotonin is a happy hormone which helps in PMS. Good sleep. I cannot stress on this enough. We've actually made a video on good sleep, how it actually can help you in PCOD. So a good quality sleep, the adequate hours of sleep is something which is going to help you with PMS immensely. Then most important is finding the me time, allowing yourself to relax, finding time to do things which you like, reading, listening to music, being with the people whom you love, basically doing anything which nourishes you mentally. You know, people find relief with massage, aromatherapy, acupuncture also. So basically anything which gives you comfort and happiness and lets the happy hormones flow in the body is perfectly fine. Then let's talk about what medicines as doctors we like to prescribe for these patients. Number one is painkillers. So these are simple painkillers. They can help you with headache, body aches, joint pains, abdominal cramps. Sometimes in case a woman is having a lot of edema, swelling, we also prescribe diuretics. We also prescribe antidepressants in some cases. So basically there's a class of drugs which is known as SSRIs. So this is selective serotonin reuptake inhibitors. Little technical, so you may forget about it. But yes, in selected cases, these drugs are also prescribed. As gynecologists, we also like to prescribe birth control pills for PMS. So how do they work is, so they stop the ovulation and that's how they work. But a big word of caution, never ever buy these medications over the counter. Always buy them after getting a prescription from the doctor. So I know it is difficult for some women. some women and their families too actually find it very difficult to accept this diagnosis, let alone get it treated. But let's face it, PMS exists. PMS is real. But the good news is it can be treated very well. It is definitely manageable provided we diagnose it correctly and treat it the right way. So once again today, if you like this information, please do not forget to share it with your friends, and please do not forget to like and subscribe to Maitri in case you've not done it already. And once again, I will see you soon.